Thank you very much, and thank you for having me. Just following on from what Mark was saying, I think introducing what I'm going to talk to you about now, one of the things we've learned from talking to him is about the importance of a clear and robust methodology and involving the right experts and reaching consensus and looking at evidence when creating and devising guidelines for Duchenne muscular dystrophy. And that's one of the things that's really been a strength of DMD Care UK when working with NICE, but also when working with healthcare professionals around the UK. So what I'd like to do today is just introduce very briefly the DMD Care UK project, a little bit about why we were set up and how it works, and then you're going to hear from some of the working groups within DMD Care UK about the fantastic achievements that they have made over the last 5 years or so in terms of producing guidelines and the things that are still ongoing. So, why DMD Care UK in the first place? Some of you may be aware that in 2018, there was an international standard of care published for Duchenne muscular dystrophy in the Lancet Neurology in 3 volumes. This was received with great anticipation by the Duchenne communities around the world, including in the UK. And alongside it was a patient or family guide was produced to translate the Lancet Neurology papers, which are published open access, by the way, so anybody can find them online and read them without a journal subscription, translated into a family guide. And it soon became apparent that in the UK, talking to clinicians, sorry, I should have said at the beginning that I work at the John Walton Muscular Dystrophy Research Centre in Newcastle, so I work in a kind of clinical centre, but talking with clinicians and also with the patient community via Alex Johnson in particular at Duchenne UK, we realised that this wasn't what was happening. The 2018 guideline did not reflect the reality of what people were experiencing in the UK for various different reasons, some of them very valid, but moreover, there were differences between centres as well. So care in one centre was not necessarily harmonious with care in another. And this was causing problems or anxieties in particular, for clinicians who want to do the best for their patients, but also for the patient community. So DMD Care UK was set up in answer to this. One example that we often use to illustrate that disconnect between what was published and the reality is the provision of protective heart medication for boys with Duchenne muscular dystrophy. So it's very clear in the guidelines that by the age of 10, boys with DMD should be on a protective heart medication. Now, we heard from patients and families in the UK that this was not happening often enough, and it certainly wasn't happening uniformly across centres in the UK. So that's just one example, but there were lots of examples as well. So DMD Care UK was established as a collaboration between the patient community and the clinician community, and it is a fantastic example of those two groups of stakeholders working very closely together as partners to deliver the best care for people with Duchenne muscular dystrophy across the UK, no matter where they live in the country. It's a collaboration in particular between the John Walton Muscular Dystrophy Research Centre, which is where I work, and Duchenne UK, and Alex Johnson is the patient lead for the project, and Michaela Guglieri, who you're going to hear from in a minute, is the clinical lead and the principal investigator for the project based at the John Walton Muscular Dystrophy Research Centre. It's embedded in the North Star network, and without the input from the clinicians, many of whom are in this room, working throughout the North Star network, and the patients and the patient representatives that come together as part of this project, we would not be able to do what we do. So it's a huge thank you. There'll be lots of thank yous today, I'm sure, but it's a huge thank you to everybody that's involved and gives of their time so generously to this project. And I need to say as well, importantly, that the posts that are funded by DMD Care UK, including my own, are funded by Duchenne UK, the Duchenne Research Fund, and Joining Jack. So This is the project management team that you can see here. There are lots of other people involved, but this is the core project management team, the people who sort of do the day-to-day work and the organisation. So as I mentioned, there's Michaela Guglieri, myself as the senior project manager. We have Adam Kerr, who's also here today, who's been a fantastic addition to the project in 2024, and he works as the project coordinator. And then Alex at Duchenne UK, but with the support of other colleagues of hers at the charity. So we started off in 2020 officially. We had one working group back then, and that was the Bone and Endocrine Working Group led by Dr. Jared Wong, who is also here. And between then and now, we have launched an additional 12 working groups. So we now are running with 13 working groups looking at different aspects of care, all of them really important for Duchenne muscular dystrophy. Each of the working groups is made up of neuromuscular consultants and experts, but also experts in that particular area of care. So respiratory consultants in the respiratory group, cardiac in the cardiac group, and so on. And importantly, patient representatives. So all of our working groups sort of exist, they collaborate with each other, but they also work on their own area of standard of care. So the process that we follow, each of the working groups generally follows this overall process. We collect evidence and expert opinion, including that was published in that Lancet Neurology 2018 paper, or series of papers. We include patients and those multidisciplinary clinical experts that I mentioned before. We build consensus. It can take anything from some of our working groups have come up with a finalized guideline within 12 months. Some of them have taken more like 2 years because of the consultation and the evidence gathering and so on that's required. So along the way, we build consensus, and this is absolutely critical. We are not 13 working groups working in isolation, coming up with a recommendation and then going to clinicians and saying, this is what you need to do. We involve those clinicians along the way. So when we have a first draft of the guideline, it's circulated amongst the North Star centres and amongst the cardiologists, for example, that work with people with Duchenne, or the endocrinologists, and they're given an opportunity to have input. And we then make revisions. We maybe go out for another round of consultation until we get to a point where we're pretty much at consensus. And at that point, it's really important that we work with professional bodies, and you can see the people on the board here that have endorsed our work already, to endorse those particular guidelines. And that part is critical, because we can come up with guidelines, and as Mark said before, it's all very well having a nice pretty guideline on a shelf, but if it's not disseminated and it's not picked up and recognised by the people that need to implement it, then it's useless. So working with these professional bodies, and again, it's another thank you to them, has really helped us with getting our guidelines out to the relevant people. We publish in peer-reviewed journals, always open access for clinicians, but also families can access those if they want to, and patient and family guides are produced alongside those to make sure that everybody, and you can find our patient and family guides, I should say, out on we've got a table out in the corridor. They're all looking a nice blue colour. I think Emily puts them up on the screen before. You can take those away with you, but we will also provide them to any clinicians in the room who want some copies. They can order them from us, and they can hand them out in clinic, but they're also available online on our project website. So this is just a screenshot to show you the two of the guidelines that have currently been published in peer-reviewed journals. And alongside that, as I mentioned, these are images of those guidelines in the patient family-friendly format. You can find them online. They're also available in the corridor, as I say. And then before I close, I just want to tell you, so I've mentioned what we've done so far, but 2025 is a year where we've got a lot, there's a huge amount that's in the pipeline and is just about to be released. So the corticosteroid guidelines, which are very important at the moment with the introduction of vamorolone, are finalised. We're just waiting to be able to release those, and we hope to be able to release those by mid-April, so that people can really have a better understanding of the standards of care around corticosteroids that will include advice on vamorolone, or information on vamorolone. Orthopaedic guidelines, looking particularly at long bone fractures and contracture management. Those guidelines have been finalised. They've been submitted for publication to the Journal of Children's Orthopaedics. That's back with us with comments from the reviewers. We're making those revisions, and then publication will be accepted and a family guide will follow. And then finally and importantly, this year we'll see the release of the psychosocial guideline. We have colleagues here today who you will hear from some of them tomorrow, I think, who have been working tirelessly on this with our working group and with our colleagues around the UK. And that psychosocial guideline will be published in 4 volumes. This is our intention. 1 for neuromuscular teams, 1 for mental health professionals, 1 for educational establishments such as schools and colleges, and 1 for patients and families. So I just want to end there. You're going to hear now from some of those particular working groups, but I just want to finish by saying thank you again to our working group members who give of their time so generously, the funders from Duchenne UK, Duchenne Research Fund, and Joining Jack, and all the people who helped to raise funds for those charities, because without you, we couldn't do any of this. So thank you very much.